Hello, you guys. Welcome, welcome. If you don't already know, my name is Elizabeth Joseph. I'm owner, CEO of Be More Raw. Please visit, like, and share this video, my page. We're on the One TV, which is Facebook's only live streaming holistic network, 24 hours a day. You can find your favorite holistic educational shows. As you can see, I'm not alone today. I have a lovely guest. This is Dr. Amalia Baca, my very good friend, my actual real-life personal doctor, my son's doctor. I think my dad has come to see you. I think my uncle has come to see you.
Yeah.
So, yeah, I love and trust her. I actually recommend, I don't even know if she knows this, I recommend people to her all the time because that's how much I trust her. She's given my son an IV. That's my toddler. So I trust this woman a lot. So she is a naturopathic doctor. And we're going to talk about that today. So we're going to talk about some of the differences between naturopathic medicine, allopathic medicine, or conventional medicine. We're going to talk about vaccines. We're going to talk about the coronavirus, how to stay safe, some of the methods that she uses to treat and heal people. Can I say heal people?
Sure, I can't say heal.
Oh, she can't say it. Oh, okay. I thought she could. I don't know anything. She's going to tell me what we can do and can't do. So, Dr. Baca, welcome.
Thank you.
Welcome, welcome. Thank you so much for joining us today. The first thing I want to ask is, what's the name of your practice? Where can we find you?
Okay. So, first of all, I want to thank you for having me on this show. I'm really grateful for this opportunity. And I just opened up my new clinic with my partner, Dr. Joseph Dufour, and my husband, Raymond Baca. Our clinic is Ocotillo Center for Integrative Medicine here in Midtown Phoenix on 6th Avenue and Indian School. You can find us online as well at www.ocotilloCenter.com. Yeah, you can get information on all three of us there, the types of services that I offer, a little background, a bio about me and my experience. And so we're here to help people. So definitely.
Awesome. And she has helped me tremendously, which we're not going to go into. That's a whole nother show. a lot of ways. That's why she's laughing, because this is real life. Okay. So first I really want to talk about, actually I'd love to hear about your background as well, but I really would love to talk about the differences between allopathic medicine, conventional medicine, and naturopathic medicine. Am I using those terms correctly? And allopathic and conventional, are those interchangeable?
Pretty much, yeah. In, I guess you would say standard medicine, yeah, conventional allopathic would be referred to our, our regular medical medical doctors that most people are used to,
exactly.
Right? And where, you'll find medical schools of that kind in pretty much all states in the United States. So unfortunately, there isn't a naturopathic medical school in every state. There are only 5 in the entire world. 3 that
5
are
in the whole world?
Yeah. 5.
Oh, I thought it was just 5 in the U.S. There's 5 in the whole world, and they're only in the U.S.?
There's 3 in the United States and 2 in Canada.
Oh, wow.
Yes. They're not actually called naturopathic medical schools in Europe. They're a little different. Europe, and in other countries, it's more like traditional medicine, like, Chinese medicine, traditional. So, the traditional, in our case here, would mean like conventional allopathic, but traditional in other places would be medicines that have been around for thousands of years, right?
Very interesting.
So it's really interesting in that way. However, as far as naturopathic medicine, the schools are federally recognized. We have to go through a very rigorous 4-year pre-medical undergraduate coursework, as well as a 4-year standard medical school coursework, along with tons of other full spectrum coursework on like natural therapies, which include like clinical nutrition, botanical medicine, lifestyle counseling, physical medicine, what else? Chinese medicine as well, that we do, like acupuncture, physical medicine, things like that. Homeopathy is another big one.
Wow.
As part of our curriculum. And of course, after we graduate and get our license to practice, a lot of naturopaths will also specialize in certain things, and so they will get board certified in different things. Like, you know, some of them will be more in the psychology side,
Okay.
mental behavioral health, or oncology, things like that. So, and we also, one big difference between naturopaths and medical doctors is really the philosophy behind how we treat,
Yeah.
right? How we treat, and our principles. You know, we have our 6 main principles: do no harm, prevention, doctor is teacher, treat the whole person, find and treat the underlying cause. You know, so all of those principles are what we use to be able to figure out how we're going to do our medicine.
Okay.
Pretty much how we perform our therapies.
Yeah.
But we use part of what me and my partner and my husband here do is not only do we do very modern, you know, like IV therapy, ozone therapy kind of
Hold on.
treatments.
Naturopathic doctors do IVs? I thought you guys just did like magic and crystals.
Right, well, we could use a little bit of that too. Right, anything that helps, right? But no, we definitely use very modern technology to be able to help treat people. So
Yeah.
things that have been used decades ago, but for one reason or another, which is probably another show under politics and all of that, discussed, a lot of them are no longer used in conventional medicine or stop being used. And so
Like what?
like ozone therapy.
Interesting.
Ozone therapy is something that has been used decades ago.
Okay.
In hospitals and with standard care.
Really?
And over the years, it just stopped being popular, pretty much because of pharmaceutical drugs. But
What is ozone therapy? I see a holistic dentist, and they do ozone therapy in my mouth.
Yes.
So what is ozone therapy?
Well, ozone is a molecule of 3 oxygens, right? And so what it causes them to be in a very excitable state.
Okay.
So you have these molecules that have these extra electrons that actually allow them to have the power to eliminate a lot of pathogens. So it works great with bacterial, viral, fungal infections, things like that, really well. And so that is, it's a great therapy. And of course, like you said, the dentists will use them. Veterinarians have been using it for years on animals, right? And so one of the things that I do is I do it through IV, mix it with blood. I do injections of it to help with chronic pain, regeneration. Yes. It decreases inflammation as well, and it boosts your immune systems. It's really great therapy.
That's amazing.
So those types of therapies we can do. I also work with more traditional therapies like botanical medicine, which has been around for thousands of years, right? Our ancestors have used those, right? So yeah, so and I, because I am a native here in Arizona of this desert, I love the desert here. Then I like to use our home, our botanicals from here,
from the environment, like what we have available.
Exactly,
Right.
Exactly.
So I want to go back to the differences really quick. I know a little bit more about naturopathic doctors. It's obviously I'm not a doctor. I'm interviewing one, but some people, there's definitely some big misconceptions I want to clear up, and one of them, you kind of touched on it, but one of them is that, and I hear this all the time, it's infuriating to me, but like, there's this general consensus with a lot of people, and I would say that the number is decreasing. More people are turning to natural medicine because statistically they're seeing that allopathic medicine or conventional medicine is really not working in terms of helping us heal from chronic illness truly. It's great at masking symptoms, right? So if you go to a regular doctor and you have a headache, they're gonna give you something for the headache. However, if you come to a naturopath, right, not only are you going to give me something for the headache, natural, that probably won't have any side effects, right? If any, if I can't even think of anything that you give that has really any side effects. Are there any natural?
There is potentially side effects with anything that you can give, right?
Okay.
Or even toxicity, you know,
Okay.
people can get waterlogged, right, from just drinking too much water, right? So it really just depends on the toxicity level of the
Like the condition
substance
and the patient?
and the condition of the
Okay,
patient.
okay.
Exactly.
Okay.
So that's why it's important to really individualize the treatment, which is another thing that naturopaths are good at.
Okay.
Is to individualize.
Yeah. And then so the other thing I wanted to talk about too, was there's this general consensus that, you know, naturopaths have somehow are like less education or that they're limited. But it's actually it's actually opposite. You listed off the education that you get. Compare that to a medical doctor. Is it the same? Is it more? How much, like, if we could go, you know, line by line, what are the differences in terms of the time, the length of schooling, and like how much schooling?
Okay. Right. Actually, it did for conventional medicine. If you're just going in for like being a family doctor or general doctor, right? Typically, you have your undergraduate degree, and then you go on and you do, which is like a pre-med, degree, and then you go on and do your 4 years at a medical school. And then typically you'll do a residency afterwards. You might do a much lengthier residency or a fellowship depending on any specialties that you go into. And with conventional medicine, there's a residency for pretty much anybody who graduates, right? And it's paid for. And unfortunately for naturopathic medical doctors who graduate, residency is optional. And the big reason is because we don't have enough residencies to cover everybody who graduates because we don't have the funding for them. Most of them are privately funded.
Wow.
Right? Where in medical schools it's not privately funded. So that's a big reason. A lot of us go through residency or additional training afterwards. Like for example, for me, part of our curriculum didn't have anything to do with ozone therapy. So that was something that I learned outside of school. Right? And so and definitely like here in Arizona, it just depends on which state you are. Here in Arizona, we have a really wide scope of practice. So as long as we have a license to practice and we can prove that we have training for whatever therapy or treatment that we're doing, then we're good, you know, to be able to do that. And some medical doctors can't do that.
Wow.
As far as schooling, the big difference is going to be all the natural therapies that we learn. Like the conventional medical schools, you won't get botanical medicine. You won't get homeopathy. You won't get physical medicine unless you're going, you know, to a chiropractic school, right? You won't, and you won't get as much clinical nutrition. Like I think it depends on the state, but typically most medical schools you get like maybe 7 hours of nutrition, and it's not required, and so like for us we get hundreds of hours. So it's a huge difference.
Question? Belinda said watching from Navajo Nation.
Beautiful.
Amisa, what's up? Cool. Wow, that's crazy.
So there is definitely a huge difference in our curriculum. We still, as naturopathic students, we still have to go through and learn all the pharmacology, so all the drugs, all the interactions, all the effects, because that's what we're having to deal with. You know, patients still come into us on using medication. Exactly. So we need to know what can interact with those, how it's affecting their body, and things like that. Diagnostic tools, labs, we learn how to do all of that, how to order all of that. So we're able to do pretty much everything a medical doctor can do. Some of the other differences are like we don't we don't typically have hospital privileges. It's really based on the hospital themselves.
Oh, wow.
And then we are and then there are certain, depending on the state, there are certain restrictions like on our license. Like here, we're only able to prescribe Schedule 1 and Schedule 3 drugs. So it just depends, like in per state.
Very interesting.
Like that. So, but as far as schooling, we actually probably get a lot more variety and a lot more hours in therapies.
Interesting.
So, not to say that conventional medicine doesn't have its place, like they.
Can't say that. I can say that.
Yeah, and that's one of the reasons why I work with an MD who's completely open to naturopathic medicine.
Right.
And that's why our clinic is integrative.
Right.
It's an integrative clinic, because one of the things that, and I do admire this about MDs, is that they're really good at diagnosing.
Yeah.
They're really good at diagnosing. And that's what they get a lot of their training in, which is great. And some things, you need it. People sometimes are at a point where they're at death's door and they need something to pull them out. And so, that for sure, I feel like they should be working together rather than separately.
I could see that. I could see that.
Exactly.
And, too, what's up, Lanita? I've seen... Yeah, I also hear too, like, I think people are afraid that, naturopaths can't really help them. Mm-hmm. And I always try to reassure them it's so worth the money if you can, because unfortunately another actually big difference, which is beyond your control, is the whole insurance thing. Yeah. Right? Mm-hmm. So, and this is changing, guys, so please check your plan. There are some plans that are coming out. I think some of the big guys are starting to cover naturopathic medicine. I think Aetna's one of them.
Aetna's starting to. Cigna has.
Cigna
actually has been doing it since I've been in school. So that was like, about 10 years ago.
That's great.
And so they've been. It just depends on which plan you have with Cigna. So you have to shop around a little bit.
So check. And the other thing I want to say is I've worked with, by no means am I an expert, but I probably know more than the average person about naturopathic medicine and naturopathic doctors in general. Her and I actually used to work together at a naturopathic clinic right here in Phoenix. I was their official nutritionist, so she would recommend me. She would work with patients, cancer patients, other types of patients, and help them with IVs and all types of other therapies, colonics, whatever supplements, other therapies, and then be like, dude, you gotta change your diet. So then that's kind of where I would come in, is helping them along that path. But I think a lot of people think, like naturopathic doctors are, with the insurance, it's challenging because, the insurance doesn't cover most of it. But as I've said, I've worked with quite a few in the Valley, just in my own journey, because I haven't trusted regular medicine for a while. And I, although I made the joke, but I want to acknowledge, I agree that it does have its place. The technologies that we have with conventional medicine are outstanding in emergency and life-saving situations. Really are doing great in that realm, and I would think she would agree. Yeah. So where we're not doing so great, statistically speaking, is the chronic illness part, right? The chronic illness, and that, again, that's a whole nother politic issue because I think, I can't speak for her, but I think she agrees that it's this systematic thing that we're kind of in that is going to take some time to get out of. But it's a systematic thing in terms of the pharmaceutical company, and there's no money in healthy people. If people knew that it was as easy as like eating your fruits and vegetables for the most part, right? And that's what Dr. Baca was telling me too when I first met her. I remember she had this handout that she gave all of her patients, and it was just general guidelines, and it said it was talking about looking at your furniture was on there, and chemicals in the furniture. I was shocked because I was aware of that. I've never heard anyone mention it, and it had just some general guidelines of diet, eat more fruits and vegetables, just some general things on there. I was really impressed.
breathing.
Deep breathing, and I was super impressed that I was just like, oh, she's special. That was when I first met her. But yeah, with the insurance, I want to go back to that really quick. Naturopathic medicine in general tends to be more expensive. But in my experience, I want to say two things about this woman right here. Not all naturopathic doctors, and not all doctors, right, are created equal. Just like there's, crappy pizza and good pizza. That's a bad metaphor. Your pizza right now. Okay.
Right.
But I've gone to quite a few naturopathic doctors in the Valley. Probably a little under 10 that I've seen, generally speaking, like that you don't know, including her. That just on my own in the years, and probably, I don't know, probably about 10 years or so. And I had one try to put me on hormones because I lost my period. And I remember thinking, like, dude, like, this is why I'm here. It was like, no, I don't want to be put on hormones. Like, is there another way? She looked me dead in the face. Was like, no, there's not. And I had really, right after my pregnancy, really bad hormonal issues. My estrogen was in the toilet. Do you remember the number?
Mm-hmm. I don't remember the numbers.
I remember what's it supposed to be? It's like in the hundreds or something?
Estrogen?
Yeah.
Yeah.
And
if
I think
somebody who's not in perimenopause, yeah, it definitely should be like over 200.
If that's what I thought, should be over 200. If I remember correctly, I know she doesn't exactly, but I think my estrogen was like, it was in the double digits or something,
Mm-hmm.
and that's insanely low.
Mm-hmm.
And so she did not say, hey, you got to go on hormones, right? And even if that bad. She's looking for another way. Well, she knew another way. She didn't have to go look for it. She was like, you try this, right? And so I'm doing much better now. We did a lot of other things besides this method. But so that was the first thing, was that not all doctors are created equal. And I have gone back. Like, I was working with her, and then I had another doctor, and I just kept coming back to her. I was like, why is she not my doctor? And I was just like, this is stupid. I was like, and I know her. Two, she's actually the most affordable naturopath that I've personally seen in the Valley. And I tell people that. And I'm not saying you are the cheapest. I don't know that.
Right.
I don't know that you are. But the rates that I've found, on average, you seem to be the cheapest one and the best quality that I've found in the state. So yeah, I constantly am telling people, please stay. It's so worth it. You will be paying more in the long run for your health. I promise you. And I tell people you can marry them, like she said. I go to, if you have access or some kind of insurance, you can go to your regular doctor, maybe for that initial appointment, maybe for the lab work, right? Maybe to get the diagnosis, but then if you can, please stay. I really just can't stress it enough how different it is. But yeah, then you can take that diagnosis to her, and then maybe it'll be, maybe you can do a Skype session, or, you know what I mean? There's different ways to approach it, but it's definitely really, really worth it. I just can't stress that enough.
And I just want to comment too on that, because I know that even now with our medical system, like, a lot of people end up paying $600, $700, $800, $900 a month just as a premium to have their insurance,
that's
right?
Crazy.
And like, where you can use that instead of paying the premium for that, right? And where sometimes you still have a deductible to meet or co-pays, right? When you go see, like, you can use that money to have a naturopath, right? And then just have, I know some patients that I know have like emergency insurance. Emergency medical insurance, but then they have, then they see a naturopath, doctor. Flexible spending accounts,
Ask your job accounts. If you have, HSA, is that another word for it?
Too.
Okay.
They're two slightly different, but both of those potentially can cover naturopathic medicine and the therapies as well. So that's really, those are different alternatives. Now there are also insurance companies that are more community-based, and they will cover naturopathic, like, what's it called, Green Liberty?
Green Insurance. My mom had that for a little bit.
Liberty Insurance, things like that will cover naturopathic medical services. So you can always look into those different things as well. So, and one of the biggest things is, like, what we do is as naturopaths is prevention. And so that ultimately will save all of us money.
It really,
If
really
that's
does.
right,
It
yeah.
really does. And that, I've been talking to quite a few people at work about it too, is like, I've talked to somebody today and she was telling a story about how, yeah, my doctor, I had to take, what was it? Percocet or something. They prescribed him Percocet or, what's the Xanax? It was Xanax. And she said, because I had lower back pain and they said that my back was tender. I said, what was the diagnosis? Yeah, look at how confused she was. She said, yeah, her back was tender. So she's like, I had to take Xanax. And I was like, because your back was tender? And I'm like, well, because I'm also a colon hydrotherapist, if some of you know. I said, I'm not a doctor. I can't diagnose you. I said, but a couple things. The doctor, one, didn't tell her. They just gave her pills for the pain. That's it. Mm-hmm. They didn't. I asked her this. They didn't tell her how it became. They didn't even try to figure it out.
Right.
I was like, did you actually know that actually could be diet related? And sometimes men and women get this back pain because their colon's stretched out because they're eating a poor diet. And I was like, that's not a guarantee by any means, but I said it is a possibility. And I was like, your doctor didn't even mention that to you, did they? As a possibility. So, yeah, really, really interesting. So, okay, so we kind of talked about the differences a little bit. Let's talk about, I don't know, did we feel like we covered chronic illness a little bit or cancer? How do you treat some of those things? Tell me, how would you approach some of these more serious diseases?
Yeah, so with chronic illness, it's so rampant now because we've really looked at it more as far as medical health care. We've really looked at it more as symptomology. So we just kind of look at the symptoms. Okay, here's a medication for this symptom. Then something else comes up. Okay, here's another medication for this. Just to kind of get the system to continue running, right? Pretty much. And so because of the differences in philosophy and how we approach healthcare, naturopathic doctors really try to go into finding the cause.
Right.
And so a lot of times it's like, okay, with the chronic illnesses, we have to look at not just the symptoms, which we definitely want to give some relief to our patients, right? So, because it can cause chronic illnesses. There's a huge correlation with like depression, right, and anxiety, things like that. And so we want to make sure we address those symptoms, but also get to the root cause. And so typically what we do is we look at the foundation, foundation, which is a lot with nutrition, lifestyle, right, environmental, which I do a lot of too, environmental medicine, and that's why my sheet talked about like different pollutants that we might have in our home, that we might be putting on our skin or in our hair, right? The chlorine in our water, right? Things like that.
Chlorine,
and
fluoride.
So, right, fluoride. So all these things compound and are a big factor in keeping, not necessarily can be causing the chronic illness, but keeping us in the chronic illness, right? And so we're looking at all those things, looking at the medical history, figuring out, okay, what could be causing these things? And so we do a very extensive medical history assessment to really try to figure out what are those causes. But typically what we do is we don't just approach it from one end. Right. We approach it through multiple ends, so we can make sure we cover different things. Right. And so that we can be able to help the patient, right? Help them get better sooner. Yeah. And so really with botanical medicine, with chronic illnesses, I typically will work first. I talk to the patient about foundational improvements like nutrition and lifestyle, environmental, like those things that they have control over, right? Get those online, so that they're not a huge factor. Ultimately, that we're, so that we're not going, struggling with the uphill battle, right? And so we get those online, and then we start doing other types of therapies that are a little bit more extensive or can be a little bit more aggressive, depending on the aggressiveness of their chronic illness, right? Like have they been, have they had diabetes for 15, 20 years, so that can take a little while for you to start feeling better, right? But
Yeah.
if you're committed and you make the changes that you need to and you're consistent with it, like, I mean, you can see good results within 6 months to a year.
Yeah.
You know, so it's just, and it just depends on the person. You know, some people don't want to do acupuncture, right?
Yeah.
Or don't like the taste of herbs, right? So then,
My
you
son.
know, it's a good thing that, you know, we have, as naturopaths, we have a lot of different tools
You can
in
use.
our toolbox that
Yeah.
we can use and help people with. So,
Cool.
yeah, for sure.
So, speaking of chronic illness, you know, there's a lot of, you know, the conventional world has taken their approach as well. And so you hear this talk of vaccines. Okay. So not only is there the schedule for child vaccines is exponentially higher than what it was 20 years ago. So, and then even more so 50 years ago. So like from what our parents were getting vaccinated is way, way less than what we were, and the ingredients are different. But besides that, you know, I'm at work, you know, in an office environment, and they're like, you know, they had a free vaccine day that they covered, and I did not go to it. But you can, I mean, they're kind of everywhere. So I would love to get your take on vaccines in terms of child vaccines and adult vaccines.
Okay. First of all, I want to mention, because it's important in our discussion and why naturopaths and why I see things a little differently, is that part of what we believe in is that there is a inherent self-healing process within each person. So, which our immune system is part of. Speaking of vaccines, right? So, so that is really important to know, because what we try to do is to work and help facilitate the body to be able to do that self-healing process that it already knows, and just kind of remove those obstacles. It's part of our job. So as far as vaccines, that's a very hot topic, very controversial, right? And we see now that like California passed a law, right? Now they require, it's required that children have vaccines in California. Here in Arizona, some people actually still don't know that it's actually not required to have vaccines to be able to go to school. There's a philosophical and a religious waiver.
I've signed it.
But typically you have to ask for it.
Yes.
They will not offer it. They will not say, that's an option. So, so definitely if that's something that your religion or your philosophy is out of that, then you want to ask for that waiver for sure. As far as my stance, I don't have any children of my own, but if I did, I wouldn't vaccinate my children. That just being said, I do not advise that to my patients. Typically what I do is, what I feel is that it is important, it's the responsibility of the parents to decide for their children if they need to do vaccines or not. So my job is to educate them. So that's where I take doctor as teacher very seriously. So I educate my patients on the different types of vaccines, the risks and benefits, and I'll give them different options, you know, for the vaccinations, or at like an alternative schedule for vaccines, additional supplementation or support with the vaccines. And if they decide not to do vaccines, then there's definitely other things that we can do to help with the child's immune system.
Like breast milk. That's
yes, for sure. And like I completely, like what you had said earlier about years ago, like the recommendation for vaccines. For sure. Like back in '74, there was like 14 vaccines that were recommended.
And it was over what period of time?
Usually from like newborn to like 10 or 11 years old. Now
think of that, 14 vaccines, okay, from newborn to about 10. So
Right.
that's roughly a little more than one a year.
Right.
Okay.
Right. So, well, it just depends on which vaccine you're talking about. Because sometimes they want them sooner together. That's the
Okay.
recommendation.
Roughly.
But yeah, roughly. So, but in 2009, we got up to 37 recommended vaccines till the age of 4 to 6.
Oh my God.
Right, right. So, and what's important with that is, looking at the adverse reactions, right? There is actually a reporting system called the Vaccine Adverse Event Reporting System that you can log in. It's a government website, and that's where anybody who has some type of reaction to a vaccine, they should report it, and it will be on that website. So you can look up a certain vaccine, you can see what are the most common side effects, what are like the more serious complications that have happened, the numbers and the years and all of that. So that is a really good website to learn about those things. Many vaccines used to have mercury in them. There are still a few that do.
They don't anymore?
Yeah, a lot of them don't have them.
Oh.
But
Okay. I'll stop telling people that.
but there are still things like aluminum and formaldehyde.
Love aluminum.
Yeast, and if you don't know, egg. And some people are allergic to eggs.
Is it like stem cells?
Stem cells of I don't think
No?
so.
Oh,
No. Not that I'm
I
aware
don't know what I'm
of.
talking about.
Not that I'm aware of. But those are still toxins that
I'll
people
answer
can
that.
be very allergic to and can react to. So you want to know like what is in your vaccines that you're taking. Some of the alternatives that I do recommend is, like you said, breast milk.
Breast milk.
Breastfeeding. I do recommend at least until the child is 2 years old to breastfeed. If you can do longer, great. Love it.
So, dude, you do not hear that. I think that's such a bold statement for you to say until 2. And again, we could do a whole other show on just like
on
mommy stuff and breastfeeding.
Yeah.
Oh my God, maybe I'll do that. But it's unfortunate because, and that was one of the reasons I founded the Melanin Moms Natural Expo. If you go to melaninmomsaz.net, I'll put that in the comments. I'll start to make notes. I'll put some things in the comments for you guys. But is that, a lot of women were just not educated on the importance of it. It's really not stressed in this country specifically. It's frowned upon in this country. It's like, what are you doing? Cover yourself up. Like, oh, you're still breastfeeding. I mean, and when I come from both sides, like I'm a mom, like if you have to stop, you have to stop. Like I get it, but like to hear a doctor say that to me is so important because it stresses like it's so important. Like, did you know? I think it's the antibodies actually increase, and I think the protein doubles or something after a year. I heard my midwife say it. I don't remember, but like a lot of the beneficial things in the breast milk, they multiply as the baby gets older. It's a two-way street. So your baby, right, is sucking on the breast, and the saliva actually goes into the nipple, right? And your body goes, oh, there's a little virus brewing in that little baby, and it'll make antibodies for that specific virus and put that in the milk for the baby. So, and I maybe she can't say this, but I've heard people say it's kind of like a natural vaccine in a way. It's got no side effects. It's literally made specifically for your baby. So, and I remember when I was seeing her, I've seen her for a while. My son had like an eye infection, or he had a sty, and one of the things that she said that we could do was actually put breast milk in it, and we did. He didn't like it very much. Hold him down and put. I was trying to figure out the best way to do it. Should I squeeze it out? That was a whole nother. I think what I did, how do I do it? I think I squeezed it. What the best way was I squeezed it into something and then I sucked it up with a dropper or a spoon and dripped it in there. But and it worked. It was actually super effective. Oh, it was pink eye. He got pink eye. He's had pink eye and he's had a sty. And it was gone in a couple of days. We didn't give him. He was not given any antibiotics. I mean, it was super effective. I mean, he didn't like it very much, but it worked great.
Right.
Yeah.
Exactly. Beautiful. Yeah, for sure. So that's definitely a recommendation that I give to patients, whether or not they decide to do vaccines or not, right?
Sure.
One of the things that I also had to have parents know, because a lot of people don't know, is that our immune systems don't fully develop until we're 11 years old. So and those first 2 years are just so really critical, right? And so one of the things, if possible, is limit daycare. If you can. I know it's not always possible, but especially if you're not doing vaccinations, avoiding, because of course those little brewing stations.
Yeah.
So that can and also avoiding adults, immunocompromised adults, because a lot of times it's through adults that young children get sick. Because for us, it might be maybe a little sniffle here or congestion here, but nothing really major.
Yeah.
But, then we go and kiss the babies, right? And then we pass it along. And so
And
limiting
they're gonna
that
react
type
differently.
of contact, yes.
Because it's a tiny little baby.
Right, because their immune system is not fully developed,
Wow.
right? And so they're going to react much stronger to that, right?
Wow.
And so limiting those types of exposures, like I said, alternative vaccine schedules also, and also supplementation with different nutrients. There's studies out there that have showed how different nutrients might be deficient in children who do develop like measles or mumps or those kinds of things. And so supplementing with like vitamin A, EFA, zinc, selenium, different things like that can really help with their immune system, and also help reduce the adverse effects of vaccinations as well.
Okay.
So there are some certain types of children or certain things that I definitely would say that you should avoid or limit vaccines with, like if your child is on the autism spectrum, or if there's a family history, like then you might want to really limit or avoid the vaccines that you're doing. Anytime that your child has cold symptoms, right? If they're already compromised, then you're going to end up giving them something that might even cause them to get even sicker, right?
Wow.
So, if you are going to do vaccines, wait until they're completely healthy, and then do the vaccine, right? Also, like I said earlier, egg allergy, and then if they're immune compromised. Right? Any type, just like the cold symptoms. So those are times that you want to really look at, okay, should we really avoid and limit? And one of the other things about like doing an alternative schedule or limiting the amount of vaccines is, some of them actually come in 3s or 4s together. And so you're giving a vaccine, 3 or 4 vaccines at one time, which can be a lot for a little child, right?
Yeah.
And so, and a lot of these, the vaccines aren't actually tested as a group. They're only tested individually.
Wow.
So for their safety.
Wow.
So
right.
then
Right.
you especially if they're live vaccines, you really want to be careful about
What
that.
is live
right?
vaccines?
So when the actual component is a live bacteria or virus,
Interesting.
usually they're like either inactivated or it's a very minute amount.
Wow.
So it's not as potent. But there are still a few that are still live vaccines that way, so you have to be careful with that for sure. Mm-hmm.
Crazy.
6:44.
Cool. Okay, cool. All right, that is crazy. So, yeah. Oh, I had one question. And I want to answer one of the questions out there.
Sure.
But you mentioned limit daycare if they're not vaccinated. Is that because you think that that non-vaccinated kids are more susceptible, or more so, or what? Why did you mention that specifically?
Specifically, usually for the first 2 years of life, because a lot of some of these infections like whooping cough, RSV, pneumococcal, can cause meningitis. They can be very, they can be very severe and cause and be very scary for parents, right? And so You know, even though the statistics might show like a very small percentage have these very severe complications like encephalitis, you know, which is inflammation of the brain.
Oh my God.
Like you don't, you know, a lot of parents, that's scary, and
It's
you
terrifying.
don't, you know, whether or not it's 0.5%, right? And so knowing that, you know, it's much deadlier when they're under 6 months. So then you know, okay, well maybe the first 6 months for sure I don't want them around big groups of people.
Anyone.
Right, exactly. And that's typically what I recommend for my parents. It's like at least for the first 6 months,
Okay.
like don't take them anywhere, right? Because usually, and especially if they're preemies.
Okay.
Especially if they're preemies,
Okay.
because you know they have to you know, usually even just a part of their immune system is still very compromised. It's still developing, and it usually develops more in the womb. And so then premature babies are much likelier to have more complications.
Okay.
Right? And so definitely like avoiding large groups of people, not just daycare, it's just, you know, because you have a lot of children there, but it can be like big groups of people, like going to church or,
Right.
you know, like different things like that. And so just to be on the safe side, because usually a lot of these infections are a lot deadlier and riskier when they're very young. Yeah, under 6 years old, under 1 year old. So yeah, if possible, you know, try to keep them out of daycare during that time.
Do you think, this is a belief that I personally have, and I want to know where you stand on it. Do you think diet and nutrition from like that young of an age, right? Whether or not the mom breastfeeds and or her diet affect the child getting sick or the severity of it? Because I thank God my son he's been sick. He's 3. But, yeah, it's terrifying to think about, like, some of these scary diseases that you're talking about. But I have friends, I mean, and their kids are constantly on, not only are they sick, they're constantly on antibiotics. I keep telling them, like, don't do that. You're setting them up for failure. Statistically, it shows that these kids actually come back and get more and more infections once you begin this schedule of routine antibiotics. I'm not saying never, right? You never need it. But generally speaking... Yeah, so I guess what's your opinion on that? Do you think, and then we'll move on to the next topic in terms of, like the mother's diet and or breastfeeding and or the child's diet, anywhere from 6 to 2 years old, affecting the severity.
So I do also preconception care. So I definitely recommend, if you are planning to have a child, you really should start at least 6 months prior to even trying to have a child, right? So that way you are creating, you know, just like your home is an environment for you, you know, and if you have some toxic issues at home, whether that's mental, emotional, physical, that's all going to affect your health. Right? And same thing for baby. You know, if your womb and your body, which is this home for this new life,
for
right,
like a year almost,
is toxic, then they're not going to be able to have what is best available to them. Right? And so, if you can, and I know nobody's ever prepared for it usually, right? So it's good to even
change your diet now. That's what she's saying.
Exactly.
Do it now.
Do it now.
Don't wait.
Right. Exactly. So and even then, you know, there's times that even you can have the best diet and all that, and there still can be a few issues here and there.
Oh my God!
But,
remember me? That happened to me.
Right.
I think she literally said at one point, and I was so sick, you guys. I was really bad. I went through a lot of things, and she was there the entire time. But I think I remember one point, and she said, your diet's dialed in. You're almost, I think you said something like the perfect diet. Not that there is a perfect diet, but like just to prove a point, she's like, you've got to get your anxiety under control. I was having panic attacks. I was having breakouts. I was constipated, and I was on a 100%. And I'm not saying that people need to be raw, so please don't. That's not what I'm saying. But I was on an all raw. I was 100% raw vegan, and it was very balanced. And she knew that, so I was eating a ton of leafy greens, a ton of healthy fats, nuts, and seeds. I was just like, I had a ton of trauma that I hadn't dealt with.
Right.
So I can definitely attest to that issue, which is like, yeah, that was very challenging.
Right.
Okay, so let's move on to the vaccine. Off of the vaccine topic, I would definitely love to talk about babies more. I want to talk about cord cutting, delayed cord cutting. There's a lot of things I want to talk about with that.
I know.
Yeah, but anyway, so let's move on to, we have about, we might have to, maybe next month. So let's move on to like today, current events today, the coronavirus. People are freaking out. I'm trying not to freak out, but it's hard. I posted something on Facebook and it started a war. First of all, I thought it was funny. And everyone was like, you called it a hoax. I'm like, I never said that word, by the way, but that's besides the point. I'm not going to talk about my opinion of it. I'm not here to convince you of anything. What can we do to keep safe? Are you concerned of the severity of it? How would you treat it if someone came in? What's your general opinion on that? Whatever you want to talk about. Yeah.
Right, sure. So for me, I believe prevention is the best medicine. So if, the healthier that you can be, that's going to be the best. You might get sick, you might have it for a day or two, but then you get rid of it. So, or you don't get it at all. So really the prevention, I think, is best medicine. Of course, I think like any other viral infection, whether it's like a really hardcore flu season, people are concerned, you know? Here in Arizona, so far of the coronavirus, we've had 5 cases. 2 of them have been confirmed coronavirus. The other 3 are presumptive, but no deaths. Nobody has died. Usually those cases that do come down with the coronavirus are usually more elderly, immunocompromised. So those who have, we talked about earlier, chronic illness, right? Chronic illness where their immune system is very compromised, and so definitely those people will definitely want to do more to help bring their immune system, help avoid contact with people who are sick, whether or not you think they have coronavirus.
Right.
I mean, you should still avoid people who are sick.
Yes.
Like any flu season, like don't go to work, don't go to school.
Yes.
Be good to yourself, stay home and get well. Sleep, exactly.
Sleep is so important.
Right, exactly. So, for me, it's like really prevention, hygiene. Hygiene is a big one. And then doing the most that you can to keep your body healthy, which is going to be food, avoiding toxins, whether that's in your food, whether that's in the environment, whether that's stress, right?
Okay.
Stress, mental, emotional stuff, right? Avoiding that stuff, and then doing some things to help boost your immune system. We talked about a few of those earlier, like ozone therapy. Ozone therapy is great to boost your immune system. There are different forms of it that we can do for all ages. And there's some homeopathic remedies that I use too to help boost immune system.
Okay.
Those are great. Remember we did that for your son.
I was just gonna say, she gave my son a shot. I didn't even know this was a thing. She's like, it's a homeopathic shot. And I want to point out, I'm sure some of you have had shots or your kids have had shots. My son has actually had antibiotics before, an antibiotic shot, and they had to numb him, and it was super painful. It was awful to watch. It was awful. And so I was very nervous about this homeopathic shot, and she's like, oh no, he probably won't even feel it. And I was like, what? She's like, yeah, it'll probably feel like a little pinch. He didn't even notice it happened. I think the second time he did, I wasn't here the second time, but the first time I was like, kept him looking away. And I was like, actually, maybe I should let him see it so that he's not traumatized by it and he can see that it's okay and that it doesn't hurt. Like, how cool would that be if his earliest memories of getting a shot are actually healthy memories of it? And that's a whole other line of trauma he'll avoid, which I thought was cool. But it's very interesting. I didn't even connect that, what's inside the shot will hurt, like, or not. Like, it will make a difference, the amount of pain you feel. So, yeah, she gave my son a homeopathic shot.
Right. Also things like botanical medicine, doing different types of herbs that really help. boost your immune system, like echinacea.
Echinacea, you can find at the store,
Burdock
guys.
root. Oh yeah, tons of these different herbs, right?
What about colloidal silver?
Colloidal silver is also good. That definitely can help with that's not necessarily boost immune system,
Okay.
but helps to clean or helps to kill off pathogens.
Okay, so that's
So
more
that's-
killing off because it's a natural antibiotic, right? Am I correct? Okay.
Mm-hmm. Yeah, so that's more like that as well.
Okay, see,
And
look,
then
I'm learning.
and then some more some more traditional things. Like one of the things that I like to do is sage the clinic every morning. And actually, sage is a very antimicrobial plant, right?
Boom.
And so that helps to clean the air, clean the atmosphere of
Wow.
not just viral bacterial stuff, but also energy.
Energy.
Right?
So it's not just hippie stuff that cleans
no.
the energy. It actually is an antimicrobial plant. When you burn it, there's a purpose for this. So these hippies are onto something. That's me. So real quick, before we do get out of here, I just want to let everyone know again where they can find you,
Right.
your name, where they can find you, and I will be sure we're gonna put some of this in the comments, guys, so you're able to find her. Okay, I'm gonna put some of the recommendations in there, and some of the website that she mentioned as well. But tell us again where we can find you.
So you can find me most of the time down here in Midtown Phoenix on 6th Avenue and Indian School.
It's across from Natural Grocers.
Yeah, right across the street from Natural
It
Grocers.
is.
It is, right? The clinic is called Ocotillo Center for Integrative Medicine. And we also have a website at www.ocotillocenter.com. That's OCOTILLO Center, CENTER.com. All right, and my number here is 480-382-2565. Give us a call whenever, or look us up on the internet. You can also make appointments through that, or send me an email. All right.
Awesome. I want to thank you so much for coming. Again, my very, very good friend, my actual personal doctor, my family doctor. I really do love this woman. I can't say it enough. I really urge, and if you want to have both doctors, fine, but I urge everyone, every single one of you, to get a naturopath. I do personally recommend this one right here, this one. Again, they're not all created equal. I have seen, I've seen some that are not so great. I think also, just to attest to what she was talking about earlier with being modern, I'm still impressed by how modern and current that you are. And to me, considering things like, and she considers all of this, the chemicals in your home, your furniture, EMFs, your stress, your sleep. I mean, to me, that's modern medicine. To me, is really encountering, because these chemicals that are in our lives today, these are modern. This is a new thing, right? That we're introducing to our bodies, to our babies. There's a summit I listened to called the Toxic Home Summit, and they actually were talking about even a chemical that sits under your drawer that's never been opened.